year that encompass both this year's fiscal year 14 and next year's fiscal year 15 funding. They've been able to get at least the 12 subcommittee amounts divvied up in both the House and the Senate. Of course, those numbers are different because of the focus that the House has and the focus that the Senate has. But I put this slide up to share with you the discretionary funding in the federal government is divided into defense and non-defense discretionary. And non-defense discretionary sounds like things that don't matter much, but they really are the bread and butter and the work of the country. So funding for transportation is included in there. Funding for the State Department and foreign operations is included in non-defense discretionary. So it kind of sounds like, and I've used this phrase before, it sounds like movie tickets. So it sounds like some discretionary spending that you could do away with, but it really is the bread and butter of the country and in the federal budget. And within the non-defense discretionary portion is the HIV and AIDS domestic funding. So funding for the Labor, Health and Human Services Subcommittee and Education is all in one bill, and that's where funding for the Ryan White Program and the National Institutes of Health, the Centers for Disease Control and Prevention, all doing the HIV domestic work is included in those bills. And the funding for HOPWA, Housing Opportunities for People with AIDS, is included in the Transportation HUD. So all of those requests are included in the green portion listed on this circular slide. So you'll see defense is clearly half of the discretionary pot, and that's how the legislation has it divided, and then the rest of non-defense is the red. So the HIV request is $818 billion for this fiscal year coming up. So as we go into looking just at the discretionary portion, again, the non-defense discretionary portion, HIV funding is a very small slice, and the HIV request is the community's request, the community coalition. We work together here in D.C. and with organizations around the country in a coalition group called the AIDS Budget and Appropriations Coalition. I'm one of 3 co-chairs of that coalition. So each year we reach out to all of our colleagues around the country who take responsibility for the Centers for Disease Control, the Division of HIV, viral hepatitis there at CDC, STD prevention, TB prevention, just to come up with a number that we think, most of the time it's not the number that is needed in the community, but a number that we believe is reasonable to request at this time. Because as you all know, we are, of course, in a very tight fiscal environment. It's kind of a fiscal environment of our own, of the Congress's own making, but it is a tight fiscal environment. So the HIV request in the red line here is the addition of the funding for CDC programs for HIV domestic funding, HRSA programs, which of course includes the Ryan White program, and then Community Health Center funding, Title X funding, Title X, of course, being a lot of the Planned Parenthoods around the country, research at NIH, and the HOPWA program, which is, again, housing for people with AIDS. So that's in this small red slice. So we aren't a really large part of the non-defense discretionary funding, but we do need to care about the big picture. This is a breakdown. The as I said, Senator Murray and Congressman Ryan worked together to come up with the budget, the large budgetary caps that the Congress has to work within to put the funding out. So for fiscal year 14, the numbers are listed there for defense and non-defense, and then the bipartisan agreement is the agreement I'm talking about. So for defense for 14, it was $520.46 billion, and for non-defense, it was $491.77 billion for available to be used in 14. This year, both of the pots were increased slightly, and then all of the defense number stays in the defense category, and then the non-defense discretionary funding is divided among the other 11 appropriations bills as we go forward. But the difference between this current year we're in, fiscal year 14, and fiscal year 15 is $690 million. And you'll note that the HIV request is a little more than $8 billion. So already we know we're not going to be able to receive all the funding that we believe we need to continue to work on the domestic HIV portfolio. So, in just to break it down a little further for you, in the Centers for Disease Control and Prevention, there is one center that covers HIV, STD, viral hepatitis, and TB is also included. I didn't include that on this chart, but this is the funding that was received in millions in fiscal year 14. The President's request for fiscal year 15 is listed here on the right side: $793.2 million for HIV, $157.7 for STD, and $31.4 for viral hepatitis. So he recommended an increase for HIV prevention in his budget request. The community request, as I talked about, 415 is higher in all of the categories for fiscal year 15. Right now, the process is the Congress is reviewing, the House and the Senate separately are reviewing the Labor, Health, and Human Services and Education bill, and they will determine how much funding they want to put in each pot. The House has not done any public work on this in either subcommittee or full committee, and the subcommittee in the House may not mark up as what they call the review of the funding, because their subcommittee chairperson is Jack Kingston, who is running for Senate in Georgia, and he's in a primary runoff that occurs on July 22nd. So it's not clear if they will mark up a bill before his runoff. The problem for him would be that if he presented a bill, it would show that he wants to spend government money. And, of course, the conservatives are running to show that they're very fiscally conservative, and that could be a problem for his race. So it's not clear whether they will force, they being the Republican leadership in the House, will force that bill to come up before his reelection, before his primary runoff election. If it doesn't, that really only leaves a week and a half for the Congress to review and bring that bill to the subcommittee, the full committee, because they'll be on August recess from August 4th and coming back September 8th after Labor Day. And the closer this bill gets to the November general election, the harder it is, again, for it to come up in on the House floor and or the Senate floor, because the opponents of those running, everyone of course running in the House, and a third of the Senate running for re-election in the Senate, that could be problematic. So it's not clear that we'll see what the House or the Senate have decided. The Senate has at least brought the bill to subcommittee level, and they've discussed and debated it in subcommittee. There are some tables that have been released. I'm not clear how folks got them. I will say that the numbers are not final until after it gets through the Senate full committee. So I did not share those numbers with you here because I know that they are subject to change, and the Senate is not going to bring the bill to the Senate Appropriations Committee because it is the bill where the Affordable Care Act is funded, and that could bring up some amendments that some of the Democratic members would have a hard time with that vote, as well as the Republican members would have a hard time with the vote. So it's pretty clear that the Labor, Health, and Human Services bill won't be finalized until after the November elections. But that's just giving you a sense of the process. So this is the Ryan White program funding for fiscal year 14. Then the President's request, fiscal year 15, I'm going to come back to that in 1 second to talk about one more piece. And then again, the community request at the bottom of this chart, just showing how much we think we need to get to help to address the HIV epidemic. Now I'm going to focus on the Part D column here, and I don't know if you see my arrow moving up and down or not, but in fiscal year 14, which we're in now, the Part D, Ryan White Part D program received $75.1 million. The President's requested zero for the Part D program for fiscal year 15. He wants to, his suggestion was to include Part D funding in with Part C, and they actually gave a $4 million increase to Part C after they added in the Part D funding, and they want to spread it out through that fashion. What we were told by the Office of Management and Budget is that this would help to stop a bit of the administrative burden that some of the organizations have, that there are quite a few Part D programs, that are in Part C clinics already, and that would help that situation. The community, the AIDS Budget Appropriations Coalition especially, wants to continue to have Part D funded separately, and we believe that it needs an $85 million amount for fiscal year 15, so a $10 million increase over what's being received now, but keeping it separate. In the Senate subcommittee chart that, as I said, has been distributed, but is unofficial, I have to be honest. It does show that the Senate would like to keep it separate as well. The President's budget is on his budget request is simply that, a request of Congress with what his ideas and his administration's ideas are for how funding should go in 2015. So I believe my time is up, if not close to up, if not up, and I can answer questions later on in the presentation.
Great. Thank you so much, Donna. And we will have time for Q&A later. And I know that at least one question has already come in on the chat that we'll get to around how the community request gets developed and things like that.
Absolutely.
So we'll circle back to that. And thank you, Donna, for that really great presentation. I'm going to just talk a little bit about Ryan White, kind of framing, what it is. I think folks all mostly know, but just to give a little bit of background, the Ryan White program is the third largest source of treatment and care for people living with HIV in the U.S. It is also the largest source of discretionary funding solely devoted to HIV. And Ryan White was last reauthorized in 2009. We know that it expires this year, but there's no sunset provision, and so appropriations can continue without reauthorization. And so part of the position that the community has taken, there's been a community sort of majority position that's been put out, and it's been put out through the Ryan White Working Group of the Federal AIDS Policy Partnership and the AIDS United Public Policy Committee, which is a large coalition of organizations from across the country. And that position is that reauthorization of the Ryan White program should wait. We should wait to reauthorize until the Affordable Care Act has gone through at least a year of full implementation so that we can collect relevant data to understand how healthcare reform is working for people with HIV. And I think this is really important to the Part D conversation because it places the conversation about Part D in a larger context, which is really, we shouldn't be making any changes to the Ryan White program at this point in time because we need some time to figure out how healthcare reform is going to work for people with HIV. So we don't need to reauthorize yet. The community is basically, the majority of the community is really asking Congress to hold off and, let's just see how things go. Let's continue to appropriate at the levels that are requested by the community, which is the slide that Donna just showed us. Let's continue to appropriate funding, fund the programs, fund them as they are, and watch what's happening. And so what happened with the proposed consolidation of Part D? Well, basically the president's budget proposed consolidating Part D into the Part C program, increased the funding for Part C by about the same amount as the Part D budget, about $1 million more. And basically said, that in terms of rationale that the clients currently served under Part D would be eligible for services under this new consolidated program, that the merged program would emphasize care across all vulnerable populations, genders, and ages, and it had a rationale, in addition to reducing the administrative burden, the reporting burden. It also talked about better targeting resources along the care continuum to improve patient outcomes. And pointed out, as Donna said, that 67% of Part Ds are currently dually funded by Part C. So they're already, 2/3 of the programs are currently already doing, sort of double reporting, getting two different pockets, two different pools of money to provide two different sets of services. And this was the administrative burden piece is something that we definitely had been hearing, I think, for a while from some of the Part D grantees, many of whom are funded by other sources in Part C and other sources. So, of course, as folks know, this provoked a pretty big community response. The proposed consolidation of services provoked a lot of responses, and these are just a few of them. AIDS Alliance for Women, Children, Infants, and Youth responded. PWN USA responded. The Women's HIV program at the University of California, San Francisco responded. This is their press release. There was a Facebook group that started called Save Ryan White Part D, the founder of which is on the webinar here with us today. And the 30 for 30 campaign responded as well. And I'm going to talk a little bit about what the response has been to date. So our position that we took as PWN USA, and this is after talking to a lot of our constituents, our members, many of whom work in Part D programs, receive services from Part D programs, some are running Part D programs, and, basically these were some of the concerns. That Affordable Care Act implementation is currently underway. This consolidation could really destabilize services at a critical time. when people are already transitioning, and we want to be providing them all the support we possibly can. We know that Part D is working. That's actually, it's been, very well documented that rates of vertical transmission from parent to child have been drastically reduced in the U.S. And so we know that Part D is working, and we know that Ryan White is working compared with national data around retention in care for female clients. National retention in care data shows that about 41% of women living with HIV are retained in care. That's a drop-off from about 70% who are linked. But the Ryan White program is actually retaining about 77% of female clients in care. And that, that statistic is a little bit old, so probably the Ryan White program is doing even better. And we don't know exactly how the Part D program is doing, but some data on that is supposed to be coming out fairly soon. Of course, we believe that supportive services are absolutely necessary to ensure retention in care, and that these services are often provided through Part D dollars, which have a lot more flexibility in terms of funding, funding peer-based services, psychosocial support, community-based programs, linguistically, culturally relevant services, legal services, and other types of things that often cannot be funded in other places, but that we know, in addition to logistical support like transportation and child care, we know women and young people often just cannot make their appointments without these resources. It's not possible. Also, are you guys hearing me okay? Somebody just put in the chat box. Got quiet. Okay, thank you. Also, there's a concern about the destabilization of community-based organizations as a result of this consolidation, this proposed consolidation. And that's because Part C, even though Part D grantees would be technically eligible to apply for this Part C funding, a lot of the Part D grantees subcontract out to, or they are, sort of collaborations of many different entities and organizations that might include some clinics and might include a lot of community-based resources and services. And so there's a real concern that there might not be resources for community-based organizations in this new picture, or those relationships might not be maintained. The way the services are delivered might not be maintained, and there's been so much work to develop these services that really work well for women and young people in communities, and that just transitioning those into larger structures or to clinics might not work very well. And then, not to mention all the special kinds of expertise that that Part D providers are really have really built up over the years. The specialty OBGYN care, sexual and reproductive health care for women who are living with HIV, which we know is very hard to find good quality sexual and reproductive health care, and women-centered care overall is a huge priority for PWN USA. We've done a lot of work to assess the state of quality sexual and reproductive health care for women living with HIV and have found it to be pretty dismal. And so the thought that we could be destabilizing the limited infrastructure that there is fairly alarming. However, we do believe, and our position is that women and family-centered services are urgently needed across all parts of the Ryan White program, not only Part D. So there need to be services that specifically work really well and are of high quality for women and young people and families in all parts of Ryan White. And we also believe that whatever we do, in this cycle, we need to be thinking long about our strategy here, because we might get those dollars back into Part D. The president's budget is just a proposal. It has to be approved by Congress. And Congress is really going to make this decision. So Congress could very well decide to appropriate Part D, but that doesn't mean that we're not going to be in the same battle again in a year or in 2 years. And so what we really need to be doing is setting ourselves up for figuring out what do women and young people living with HIV really need in terms of high quality services. What do other populations that are served by Part D really need in terms of services? How are we going to assess that and get data on it? and how are we going to make sure that those things are in place in this new Affordable Care Act environment. And so here are some of the questions that have been raised by the 30 for 30 campaign. And I'm not going to read off all of these, but I see that a couple of them have come up in the chat box. And so one of the questions that came up in the chat, I think, was around, what sort of assessment has been done around reduction in administrative burden. These are the questions that we're asking HRSA. So this is questions from a letter that was sent by the 30 for 30 campaign, which is a national coalition of women-focused HIV organizations and advocates, to the Health Resources and Services Administration immediately after the information about the proposed consolidation came out. So we requested information, what does this efficiency look like? How does it outweigh the benefit of the current structure? Which programs are going to be eligible to apply, which are not eligible to apply? What data does HRSA have on exactly who's being served and what services are provided? How does the continuum of care compare across all these different parts of the Ryan White program? We want to know how well Part D is doing in comparison to other parts. And if there are some ways in which it's doing better, we want to make sure that that quality of care is instituted across different parts. And if there are places that can be improved, we want to know that too, right? We want to know what assessment HRSA has done to see whether Part C programs are prepared to provide the kind of care that Part D is providing to women living with HIV. We also want to make sure that sexual and reproductive health care for women actually gets better. Right now, Part D has always been, Part D was not created for women. Part D was created to prevent vertical transmission, and we're very clear about that. So Part D has not historically focused on providing services, or it's not been a priority to provide services to women throughout our entire lifespans. It's been a focus to prevent transmission from us to potential unborn children, and children who are born. And so how do we actually make services better for women, whether we're having children or not, at whatever stage of our sexual and reproductive lives we're at, throughout all different parts of Ryan White? This is a really big question. And so, and there are a number of other questions on here around whether Part D's range of services will expand, what it has on unmet need issues, and how HRSA would ensure a seamless transition of services if this transition occurs, including plans to provide technical assistance to current and future grantees. So these are just a few of the questions that have been raised some of which we're still waiting for a response from HRSA on, many of which we're still waiting for a response from HRSA on. Donna mentioned earlier the Senate markup, and so this is a document from the Senate markup of the budget that we just saw last week. It's not been officially released. We haven't seen the bill language yet, but it basically shows that the Senate request for Part D, if you look at where the red arrows are, the Senate request for Ryan White Part D for fiscal year 2015 is 75. It's at 75, and so there's an additional, there's an increase actually in the Senate request budget here. So they kept Part D and Part C separate. They did not mingle them together in the Senate request. So the Senate does not seem to be following the president's budget request on this, which is a promising sign. And I'm going to go ahead and wrap up this piece here. In addition, just a couple of other really quick updates. Folks probably saw there was a supplemental Part D awards announcement that just went out earlier this week, which is part of funding that had already been in place, but current Part D grantees are eligible to apply for those supplemental grants. And if anybody has not seen that information, I can send it around. There was also a Part C FOA that went out a few weeks ago that had some language in it that indicated that there was sort of shifting towards maybe taking on some of the Part D roles and services. And so those are just a couple of other, points of information that we should all be aware of. And I will go ahead and transition over to Lucy, who's going to be talking to us about what we can do, because, now that we have some indication that that the Senate may not be going with this request to consolidate Part D, which is good, but it doesn't mean we don't need to keep the pressure on. We still do. And then there's still a need to target the House and to really think about doing some legislative visits at home in districts around the importance of Ryan White funding, continuing to appropriate the Ryan White program at least existing levels, not less, and to not destabilize any of these services. And we really need Congress to understand this, because there are a lot of new members of Congress who are not that familiar with the Ryan White program or with HIV issues. We are losing or have lost a number of champions in Congress just because they're retiring or have moved on to do other things. And so it's really important that we prioritize educating them about the importance of these services while they're at home in their districts, not only when we go to DC. And so that's what Lucy is going to be talking to us about today. And I'm going to go ahead and transition over to Lucy. I'm going to quickly change the slide here for you.
Okay, hello everyone. This is Lucy Backlund. Thank you for having me here today. As Nana said, I'm going to be talking a little bit about legislative visits. From hearing what we've heard about the budget today and with the changing landscape the Affordable Care Act has brought, now is really prime time to be getting out and advocating for Ryan White funding and services. So what I'm going to talk through today is really keys to a successful legislative visit. As Nana mentioned, really doing those in-district visits over the summer as budget deliberations are going on is where we want to be advocating. So I'll just run through these, but I do have a slide for each of them to explain a little bit more about them. So keys to a successful legislative visit. Logistically, really finding who your member of Congress is and organizing the meeting. And then following that is really some prep work before you go into the meeting to ensure that you really have an impactful meeting with your congressman or woman. So really figuring out how you can making it personal, developing your story, doing your homework, finding out statistics that are relevant to your district and relevant to your congressman or woman, working on how you can phrase it to offer solutions instead of complaining, keeping it short, and then extremely importantly, making sure you have your ask ready so you can ask that congressman or woman for their support on this issue, and then just some tips on following up after your appointment. Okay, so first off, finding your member of Congress. So there are a few ways to do this, and I'm sure many people may already know who their representative and senators are, but just as a refresher, everybody has one U.S. representative and 2 U.S. senators for their state. You can find your member of Congress by going to the AIDS Foundation Chicago has a link set up. I know many other organizations do, but just for your convenience, I've put the direct link in here. You can go to aidschicago.org/advocacy to find out who represents you in Washington, D.C., and it's super simple. Just enter in your zip code, and I would suggest putting in your zip code +4, and then it will pull up. I have on the side there who my senators and representative are, so this is what will come up when you put in your zip code information, and you're going to want to make sure you write down their contact information for their district office. It's definitely worthwhile contacting their DC office if you're out of luck with their district office, but the district office is where you probably want to try first. And if you have trouble with any of that, feel free to I'm definitely a resource. I set up many legislative visits, but definitely myself or Nana can definitely help with that. Okay, next, so you So this part can sometimes be very simple and sometimes be a little bit tricky, but you just first off want to call their office to schedule a meeting, ask to speak to their scheduler. It can be, I'll just be honest, a little intimidating sometimes, but I think it's important to remember that you're a constituent of their district and your congressman or woman is working for you, so you have every right to call and request that meeting. You want to make sure you get the email address of the person so you can follow up with them. You may need to call a couple times. Persistency can be key here. And the office may also ask you to to submit a written request to schedule your meeting, and that may just be, including your name, perhaps the town that you're from, anybody else you may be coming with, and then also including the issues you'd like to speak about with your congressman. Okay, so finding out who your congressman is and then making a meeting are the two sort of logistical pieces. The other part I'd like to cover is really sort of developing your story and preparing yourself for this meeting. So when you go in, really first things first, make sure you make it personal. Give your name, where you're from, and relevant background information about yourself. You can definitely talk about the expertise that you bring as a person living with HIV, someone working in the field, or a concerned community member. And I do want to mention, too, at these visits, you are by no means required to disclose your status. If you feel comfortable, it can be a really powerful thing to bring into the conversation, but by no means is anyone obliged to do that. So in addition to sort of introducing yourself, you really want to make it personal and kind of bring it back to the fact that you're really the expert here. You know HIV/AIDS issues, and you may very well know them much better than your congressman. You are the expert on how HIV impacts your life as a person living with HIV or as a person who is providing those services to people living with HIV. So your personal experiences provide perspective and impact beyond statistics. And what is really key about making it personal is really the power of a personal story. I mean, lawmakers need to see the human face, the human story and face to understand the policies. And what we really drill at our trainings in the Illinois Alliance for Sound AIDS policy always really talk about just putting the person behind the policy. What these meetings with legislators have the opportunity to do is to kind of, take away maybe some of that wonky policy talk, take it away from that bottom line figure, and really put a person behind that policy. Okay, so again, with making it personal, you really want to talk about the issues and programs that matter to you and why. This is definitely a perfect time if you have a story of a time when a Ryan White service really provided you with the care that you needed, helped you get to your doctor's appointment on time, provided child care for your children. Those talking about the programs, why they matter to you, is absolutely essential. And whether it's how they've helped you or how they've helped somebody that you've served. Another good way to phrase these issues is what would happen to you or other people without those programs. And what could happen if funding was taken away for Ryan White services. So the next bullet I had on the list of things to do is to do your homework a bit. So adding key statistics can really make your personal story and talking about the issues very impactful. So some ways to do that: you can gather the necessary data and develop fact sheets on your own and use those. AIDS United has a fabulous website that lists HIV/AIDS statistics, funding programs, and related policy issues specific to each state. So I've included that link on there. They are actually having a couple technical issues with that site, but I did speak with the person in charge, and they promised me it would be up and running by next week. But it's an absolutely fantastic resource, state-by-state information that you can bring into your story and bring into talking about the issues at these meetings. So lastly, along with doing your homework, I know I've talked about making it personal a lot, but along with gathering data and perhaps developing fact sheets, I would really, really suggest writing out your personal story, your connection to the policy issue, and your ask for elected officials. We have a worksheet that we do at a lot of trainings that really helps you to break down those issues, and I think that writing it out, perhaps practicing it with someone before you go into these meetings, can really help you deliver it much better when you're in the meeting. It can be a bit intimidating, so having written it out and practiced it once before you go in can really help you deliver it clearly. Okay. This one I think is really important. Offering solutions. These meetings are not really a place to complain. Offering viable solutions to these problems and challenges can be much more effective. Really sort of turning it around, talking about what is working and why, talk about where policies and programs can be improved. Many times it may, with situations that are unfair, complaining, is a really easy thing to do, but I think in order to keep the conversation positive and moving in a forward direction, really offering solutions can be key to a really impactful and effective conversation with your congressman. Keeping it short, also a key thing to remember. Sometimes you may be afforded half an hour with your congressman, which is wonderful, and definitely talk about all the issues and provide as much support as you can, but sometimes you may only have a few minutes, so you're going to want to make sure to keep it short, make sure that you are being clear and concise, making it personal, talking about the issue and making the ask. So you want to make sure also, too, that if you're going in with multiple people, that your group is well organized so you can deliver your message and ask clearly. So if there are 3 of you going in, you might want one person to sort of cover the personal story aspect, another person to talk about the issue, and then that third person to make the ask. Or if you're going in with multiple asks of support to your legislator, a good way to do it is to sort of divide and conquer those issues by person. Another thing you want to make sure is that you, with that limited time, is that you stay on issue. And it can be easy to sort of go down rabbit holes when you're talking back and forth with a legislator. Sometimes they'll bring up topics that conversation may veer. I've definitely been in meetings myself where somehow we've got on the topic of education, which is, another vital public service. However, that's not this conversation. We want to make sure that we're sticking to the topic. If that is Ryan White, I want to make sure that I get as much time as I can to talk about those services and how vital those services are. Okay, lastly, and most importantly, I'd say, is making your ask. You really want to, at the end of your conversation, or perhaps midway through, whenever really fits the best, is directly ask if you can count on that policymaker's support, and then wait and listen for their response. So one example would be, perhaps I've told my story, I've talked about the services that the Ryan White Part D offers me and my family. So I'm going to ask this congressman, can I count on you to protect Ryan White Part D services in the 2015 budget? And then I want to hear what they're going to say. So I'd like to give kind of an example of putting that all together. And I want to mention, too, this is just an example testimony, and again, nobody is required to disclose any personal information if they choose not to. This is really just an example to show how you can kind of put all those pieces together. If I go into this meeting, hello, my name is Debbie Smith, and I'm a resident of your district. I'm 29 years old and have been living with HIV for 5 years. I have 2 children, and I receive Ryan White services to help me and my family stay healthy. I next really want to talk about the issue, make sure we know what the topic of this conversation is going to be. So I'm here to talk to you about the maintaining Ryan White Part D funding, which provides family-centered medical care and supportive services to women, infants, children, and youth living with HIV. I sort of switched these, but I think this is also a good place to always bring in that personal story, making sure that congressman is able to connect with you as a constituent of their district. So and obviously you're not required to disclose this, but thanks to Ryan White Part D services, my family is healthy and I am employed. Ryan White provides me with transportation services for doctor's appointments and child care services for my family so that I'm able to work. In addition, Ryan White Part D case manager assisted me with perinatal care to prevent the transmission of HIV to my children. So these are sort of a gambit of examples of personal stories, but really providing those specific examples can allow someone to really, that congressman to really have that human connection with advocates. Another way to phrase it would really be highlighting the concern and the consequences. So my concern could be that I'm afraid that without services like these, women and children will not get the specialty care that they need that is crucial for families living with HIV. We talked earlier about possibly combining those funding streams of Part C and Part D and maybe losing some of that specialty care that Part D can provide. So it's definitely a relevant concern if you're tackling that issue. And the consequences if Ryan White Part D is not fully funded or combined with other services, women and children living with HIV will greatly suffer from the lack of supportive services, and the risk of HIV transmission from mother to child will increase. And then the ask again, kind of at the end, can I count on you to protect Ryan White Part D services in the 2015 budget? So that was sort of, so putting it all together, and then I'd like to include some other tips here as well that can be helpful along the way. We talked about this a bit, but if you're conducting meetings with other advocates, really determining who's going to cover which issues and practicing that delivery. Doing these meetings in groups is a really, really wonderful way to feel supported throughout the entire process. And if you are looking for advocates in your area or in your state to conduct these meetings with, I know PWN is definitely a resource with their regional organizers. The AIDS Foundation of Chicago as well is a resource for helping locate other advocates that you can team up with and do these meetings with together. You also want to arrive at your meeting early if you can avoid being late. If you're running a bit behind, which life happens, don't be afraid to call and notify that member's office. And then you also want to make sure to be polite and courteous. Take note of any questions that you may be asked, and if any additional information is asked of you, to follow back up with that information. If you have those materials or fact sheets, if you perhaps printed off your state HIV/AIDS statistics before you went in there, you can hand those over at the end of the meeting. Be gracious, attentive, and organized. Stay on your issue. If you are asked a question that you don't know the answer to, you can say, I don't know. And in fact, that's really best practice to say, I don't know. If you get a little flustered and, maybe sort of make up an answer, it can actually get us in more trouble because, that congressman may follow up with a lobbyist, may follow up with an organization and say, so-and-so came to visit me and they told me this, and if it's not true, it really sort of gets us in a bit of a situation. So if you're asked a question and you don't know the answer to, really the perfect answer is just, I'm not sure of the answer to your question right now. I will go home and find out the answer and follow up with you. And then you really, at the end, really wanting to thank them for their support if appropriate, but, you can always thank them for their time and being available to meet and listen. And then lastly, really, you want to follow up. I think I have a whole slide for that. So a good way to follow up could be a letter or an email. You can definitely make it cool, but I prefer to do letter or email. I can sort of get everything in there I want to say. Firstly, really thanking the policymaker or staffer for their time. This is a little out of order. So at the end of the meeting, you would tell them that you will follow up. You can send a thank you card to reiterate to reiterate your thanks and show your appreciation. You can send them any of that additional information that they requested and or answers to questions. And then you also, too, want to keep track of their support or opposition. If perhaps, they weren't supportive this time, maybe that calls for another meeting or another call. In Illinois, in our state session this year, we really found that the more persistent we were, the better support we were getting from our legislators, and I know that is the case everywhere, but we really saw that strategy come into play here, and persistence was key in getting some state funding protected this year. So it definitely applies at the federal level as well, being persistent, constantly constantly making that phone call, constantly emailing, maybe setting up a second meeting can do that. And then lastly, we definitely covered legislative visits from top to bottom, and they are really the most impactful way to approach your congressman. But I also want to cover a few other ways to advocate if you aren't able to set up that meeting. A really effective strategy is to invite an elected official to visit your HIV/AIDS organization or view a program. Let them see those Ryan White dollars in action. A second would be to write an email, letter, or postcard to an elected official. You can do the exact same strategy we talked about here with the visit, making it personal, talking about the issue, and making the ask. You can also call your elected official and do those same things. And lastly, voting is one of the most important ways you can make a difference and exercise your right to vote. So I think that's everything I have.
Excellent. Thank you so much, Lucy. And I'm just going to switch us back to the other presentation, and we are going to
Anna, can you speak up a little bit?
Yeah. Hold on one second. So we have a couple questions that came in over the chat, and I want to make sure we start off with addressing those, and then we're going to go ahead and open the lines up for other questions that might have emerged. But basically, we have some time now for Q&A, and the first question that came in was from Wahida, asking, is the community requesting higher amounts? I think this is with respect to the budget request. Is the community requesting higher amounts than what we analyze we need in order to give us some leeway? And maybe, Donna, if you could also talk about just how do those community request numbers get developed?
Very interesting question. So each part of the chart, the AIDS Budget and Appropriations Coalition chart, and I can send that to you, Nana, to share with everyone on the call, is really developed by different organizations, and I'll give you a couple of examples. So the Ryan White Program Part A is the number is developed by the CARE Coalition. Ryan White Program Part B is developed by NASDAD because they really are the ones that are kind of the advocates for that program. The ADAP program is a number that is developed by a work group that reviews how much has been spent previously. They have a lengthy formula for coming up with the ADAP number. Other programs are not quite there. A lot of the Ryan White program, I will say, the last, not necessarily for fiscal year 14, but fiscal year 13, 12, 11, the requests were the amount of money that had been authorized in the 2009 reauthorization. The CDC funding, the HIV prevention, HPAC, the Prevention Coalition of FAP, those partners come together to develop the number. Viral hepatitis, there's a hepatitis coalition that comes together, and STD, the STD prevention, NCSD, similar to NASDAD, and it's the state, or it's the organization that advocates for the state STD coordinators, come up with the number. Each group has a different process for coming to their number. They are often not the need number that the community thinks if we went through the process, if we had this much money, we could solve the HIV crisis epidemic here in the country. It's often these days a number that sounds a little more realistic and possible to attain, because we know that as the Congress looks at numbers, if we asked for example, right after the National HIV/AIDS Strategy came out, David Holtgrave came up with a paper that went through how can we uh, solve the the points raised in the HIV/AIDS strategy. How much funding would it cost to bring the numbers down as the strategy requested? And those numbers were huge. One year we did, the first year when the strategy came out, so that would be for fiscal year 12, we did use those numbers, but we knew those numbers were never going to be attained in this fiscal environment. So the numbers were revised to, sometimes it's a percentage over the previous year, sometimes it's a addition going forward. So it does really vary, and it's not there isn't leeway included in the number, and often our coalition request is not reached, so we haven't had the luxury of finding out whether the funding is whether whether we have leeway, because we haven't been able to reach the amounts that we as a community believe are needed.
Great. Thank you for that, Donna. And let me just see, Wahida, if there were any follow-ups on that, if you had a follow-up on that question at all, or if that answered your question. It's *6 to unmute. If you're not hearing Wahida, I'm going to keep moving along with the next question that came in. And by the way, you'll see there's a poll up right now on the webinar, so please feel free to respond to the poll, asking if you're planning to set up legislative visits to discuss Ryan White funding. The next question that came in was from Lauren, and it was, has any evaluation been done on how much of an administrative burden there is with Part D right now as it currently exists, I think is the question. So do either of the presenters want to respond?
I think that, this is Donna, I think that is one of the questions we were asking of HRSA, Nana, if I'm correct. There is administrative burden. Grants are due around the same time in some instances, but often in the 2/3 that are Part C and Part D, already, some of those are in different departments within a hospital, for example. So it wouldn't be the same people that are doing it, though it is the same entity. So it's a question that we know we don't have an answer to, but it is something that we think we need to figure out prior to them making this kind of a sweeping change.
Mm-hmm. Great. Does anybody want to add anything on that question? Again, start you. Okay. We have a thank you in the box on the response to that question. Another question from the other Lauren. Would the combining of funding services allow smaller community-based organizations to be funded, or would all services become traditionally clinic-based?
Again, that's not clear.
Mm-hmm.
According to the couple times I've been in meetings with HRSA asking that question, they said that Part D clinics would be eligible to apply. Then for the Part C, they would have to change the guidance coming out, because, as you know, now it is Part C is medical, the medical model. So it's not clear. We would need to be vigilant in making sure that Part Ds are able to access the Part Cs, but I think it would be difficult. I think a lot of Part Ds, though HRSA was saying they're eligible to do it, may not believe they're eligible to do it and therefore not apply. And then the other question, again, that we're trying to find out from HRSA is, if a small CBO is competing with a large hospital system in the same area, how would that work? So one of the concerns the community had is that there are too many uncertainties for them to make such a big sweeping change as we're doing the big sweeping change for the Affordable Care Act. And as we're looking at the Affordable Care Act and the changes, we have to also realize that it's there'll be vast differences in states that expanded Medicaid and states that did not expand Medicaid in the Affordable Care Act. So there are numerous unknowns and numerous differences, I guess is a better word, across the country.
Great, thank you. Any follow-up questions or any other comments on that issue? Star 6 to unmute again. Okay. I see a couple of comments. I don't know where these are coming from in the notes. There are a couple of comments that are coming in. One says that in 2013, when they recompeted, first selected the grantees we have now. They knew that these sites would be dually Part C and Part D funded at that time. Furthermore, they stated in that RFP that the new criteria would address the changing demographics of HIV. So it's very confusing that they are now, quote, punishing us for them. I don't know if the presenters have any comments on that. Anyone else on the call? Okay. Well, we can come back to that when we if people have other comments. And then there was just one final suggestion, which was about Lucy's worksheet about telling your story. Lizana said the worksheet was really helpful. Is there a way we can get a copy of that worksheet?
Yeah, definitely. I would be more than happy to share that with you. Perhaps I could email it to you, Nana, and it could. You're welcome to edit it, but maybe be a resource available to folks on the web.
Yeah, definitely. It was a great suggestion, and we can send it out along with the slides. We'll be making the slides available from this webinar, as well as the recording and any other supplemental materials. So we'll send out any other materials that are requested as well. Great. Well, let me just see if folks have any other questions. Star 6 again to unmute your line. Questions or comments? So I noticed that in the poll we asked if folks are planning on setting up legislative visits, and it looks like about almost 2/3 said yes, and about 1/3 said not sure. So I'm just curious to know what support people might need to feel more prepared to set up these kind of visits, or what the reasons might be for not feeling like it's time to set those up yet, or not having the capacity to set them up at this point. If anybody wants to weigh in, or additional resources that we could provide to make it.
Yes, Monica. As far as I guess off the top of my head, where the senators and Congress people stand as far as where they are, not making assumptions, just kind of like really researching. But that's yeah. Is there more research than just going online and looking at their website? Is there more research for it?
Great.
Like knowing how they voted in the last time, that kind of stuff.
Great. Okay, so wanting to know what their history is of support for the Ryan White program, having a little more information about that would be helpful.
Yeah.
That's a great point. Do our presenters have any resources to offer to attendees on the call about how they might be able to find out that kind of stuff?
We could find out the last reauthorization of the Ryan White program, and we could find that vote in the House and the Senate and get that back to people. The reality is, though, more than half of those folks are no longer in Congress.
Mhm.
Oh.
So your legislator may not have a record on the Ryan White program. Um, Realistically, depending on where you're from and who your how new your member is. I will say, for the most part, the Ryan White program has been a very bipartisan bill, so that it has been supported on both from Democrats and Republicans over the years. So we certainly can look into finding that, and again getting that to Nana, that you could look your member up in the roll call vote. And I don't. The other problem, I don't. My memory is getting fuzzy, but for some reason I don't think the Senate they did like a unanimous consent vote, so I don't think there's a record of the last vote in the Senate, the final passage. I think final passage was kind of on acclamation. But I will double check that and send it to Nana.
Well, thank you.
Yeah, I would say too, sometimes if you're just kind of wanting to know what sort of conversation you're going to be walking into, really just doing some research online, maybe seeing what committees or they sit on, or if they're part of a caucus, can be pretty insightful in, to where they may sit on some of these issues. But definitely doing a Google search is always helpful before the meeting.
Okay. All right. Yeah.
Great
Thank
question.
you.
Yeah, it was a great question. I know there are a couple websites also that have candidate elected official voting records, like Project Vote Smart, for example, which I think is votesmart.org. And there may be some other ones, and like On the Issues, I think has resources like that as well, where you can actually look by issue. So you could search by like health or something, for example, and look at how they voted on bills. But it does take some time to do that sort of research, and and then you have to kind of make sure you know what the bills mean. But also talking to other folks or other organizations in your community, oftentimes they might have a sense of where your legislators stand on things, and they might be working on some of these same issues too. It was a really good question. Any other questions? Star 6 again to mute or unmute. Any other comments from participants? Okay, great. Well, let's see if we have any final comments from our presenters before I go ahead and share some additional resources.
No, I don't have any comments. Thank you again for having me today.
Oh, great. Actually, Lucy, I'm sorry. There is a question that just came in on the chat box, and it says, for those that have never set up appointments with an elected official before, what is the actual process? Do you just spend a couple minutes breaking that down?
Yeah. So, what I would suggest is really just figuring out who your elected officials are, and then if you'd like to, perhaps before you go ahead to make that appointment, if it is your first time, maybe seeing if there's another advocate in the area that you can team up with, or perhaps reaching out to an organization. I know for Illinois, I definitely am happy to go and just, whether I'm traveling downstate, but just to go and be a supporter in the meeting with someone. So I'd say maybe seeing if you can team up. However, if you're confident setting up the meeting by yourself, just really calling and seeing what time they have available, or if they have a staff person that is available to sit down and speak with you. And then once that appointment is made, really just making sure you set aside time to do some prep work. You want to go in there and have a good, impactful conversation. So whether that's doing some homework, pulling up some statistics, getting fact sheets like the one PWN has available on Part D, and gathering your supplies and getting your story ready.
Now, if I could just add one quick point. Lucy did mention you may meet with a staff person. Don't be insulted or upset if you meet with a staff person. Often the staff are able to help move issues within an office. Getting a staff person on your side can get you a meeting with the member possibly the next time. But also remember the staff folks are the ones who are finalizing the member schedule. They're the ones that are writing speeches and beginning talking points. So they are an entryway and a good resource for getting to the member of Congress. And often staff, I will speak up for congressional staff, they're worked and underpaid, and they need experts in their community. So the point Lucy made about not making up an answer is real important, because you want to become the expert on HIV in their district. You want them, when the Ryan White program is reauthorized next Congress or the Congress after that, whenever it happens, you want them to call you to say, well, how is that Part D working, and how has the ACA impacted Ryan White going forward, so that you will be their expert answer, giving them their in-district information, because often they don't find out that a bill is coming to the floor until the week before, so they need quick research and quick information.
Yeah, you want to really think about this as establishing a long-term relationship with the office. And so I think, Donna's point about meeting with staffers and Lucy's point about meeting with staffers and building a relationship with them are so important. The staffers are really the content experts. The members don't have time to become content experts on things, but the health staffer or whoever their district lead is on, say, like maybe health and housing issues, might become a real resource, and you might become a real resource to them. And just as an example, we started to build a relationship with a member of an assembly member here a couple of years ago, and when a bill came up that was controversial, he actually called and he said, we're going to have to vote on this tomorrow. What do you think about it? And voted the way, and actually introduced an amendment, kind of along the lines of the language we suggested. And similar things can happen at a federal level too, as you start to build a relationship with your members of Congress and their offices. It can even get to a point. We've had experiences where staffers have sent us, confidential drafts of legislation to review and provide feedback on before they introduce that legislation. So this is really about building a long-term relationship and establishing yourself and your group or your organization as a go-to resource that can be counted on to provide accurate information, to provide thoughtful information and analysis. And so that, I think, is also part of the reason why it's important not to make stuff up, but to just say, if you don't know something, let me look into it and get back to you. When do you need a response? Really good points from both of our presenters. Let me just see. Are there any other questions? Star 6. Okay. Donna, did you have any other closing comments you wanted to make?
No, I think the one thing I would say is the members of Congress are your employees. They're put in office to represent your interests. So the only way they can do that is if they know what your interests are. So keeping in touch with the office, letting them know, and inviting them to visit your organization, either the organization you're running or the organization you receive services, is really important. And in this next month in July, they'll be home next week for the July 4th recess, but they'll be home in August for 4 or 5 weeks. Some of that may be some quality time, but this year, especially being an election year, I think a lot of the time will be spent in the district. So if you have something going on, inviting them to attend and see the money that they are appropriating in action would be really, really important.
Mm-hmm. Great suggestion. And they like to be out in the community too. It looks good for them.
Absolutely. You know, have a couple of pictures taken. Either their photographers or you guys have photographers, and put it in the local newspaper that XYZ member was there and came to visit and came to see. And these days the personal story. I'm so glad Lucy did such a great job on presenting that. Has been more important than sometimes the statistics in this Congress.
Mm-hmm. Great point. Well, thank you again so much to both of our presenters who have been really fabulous and given us so much useful information. I do want to highlight that we have a few more upcoming webinars, and so you can save the date for those if you're interested. The first one's going to be on expanding employment opportunities for women with HIV, so really looking at a policy level and also at a programmatic level, how can we do that? The second is going to be looking at intersections between intimate partner violence, trauma, and HIV, and really some of the movement that's happening right now at an advocacy and policy level with the Federal Interagency Working Group, and how that is, and how community-based organizations and clinics are also responding, and then we'll be doing a final one on research advocacy. You know, quite finalized what exactly the topic is for that yet, but it'll be around engaging, you know, making sure that we're involved in advocacy on research issues. So save the date for those. We'd love to have you join us, and we'll be sending out reminders and everything about those soon. And I just want to thank you all so much for your participation, for being so thoughtfully engaged with us here. And again, a huge thank you to Donna and Lucy for doing such a fantastic job with us here today. So thanks everyone. We'll be sending you out slides. We'll have a recording, and we will also send out that worksheet that Lucy offered to provide. So we hope to be in touch with all of you soon, and go schedule those legislative visits and let us know what help you need. We're here for you as a resource.
Bye-bye.
Bye. Thank you so much. Bye, everybody.